is there, so you can use that thing. Now, medical options, mainly these are the 4 ones that is used, which is topical minoxidil, finasteride, spironolactone and cyproterone acetate are the main streams that you want to play with. Recently, when we are treating with the spironolactone, we use between 50 to 100 milligrams. But if you use 0.25 milligrams of minoxidil, oral minoxidil, it really helps. But one of the problems with that is the patient would have hypotension. So what you can do is that tell them to have a pinch of salt, and that will solve the problem. You can always use contraceptives, but again, it could be slightly controversial. These are the treatment and the dosages of all the treatments: spironolactone, flutamide, finasteride, dutasteride, minoxidil. Coming to the adjuvant therapies, PRP, I'm not going to go into detail of that. All of you know more than it. Hair fillers, nanopeptides, SVF, herbal extracts, and low-dose laser therapy. I think that low-dose laser therapy really justifies me standing here and the lasers thing. But what it does is it basically improves the mitochondria, and that gives little energy, some increase in blood flow, as well as, and that mitochondria and increased energy increases the anagen phase. So that is how the low-dose laser therapy works. And then the PRP, we know all about the platelet activations, what are the factors, and this is the paper. You can see some patients from our clinic. This was given by one of the companies. And SVF is, a structure fraction. So you have to, this is something coming up really, and it is the smaller part, the one which is right at the bottom. It really helps, and it is coming out. And one of the important thing is it has got all these not really stem cells, but these are some sort of cells that really help the hair growth. And it is recently it has started to come up. Hair filler, gone again. Anyway, I was done. So all these things, nanopeptides, you can use different plants for this. Vibiscal is one of the tablets that I really use. One of the things in Vibiscal is aminomar, and a population in Scandinavia is are eating this fish, and they have got really, really long hair. Right, then we go to the surgical options. You really need to choose which patient, how to do it. You can improve with one session the patient, and then you can use some sort of concealer. You can, from the front, it can really give you, now this is after 2 sessions, you can really see that there is a little puff and the patient is quite happy. There is no topping in this is pure surgery and some medical options. So you have to really see and then evaluate and treat your patients, and I thank you for that. Questions later?
So very nice and in-depth. A very nice and in-depth talk from Dr. Humayun Mohmand. Dr. Humayun, I would personally like to ask 2 questions. Number 1, you are a master as far as hair restoration is concerned. Your personal experience as far as PRP is concerned, and handheld laser comb or home use laser comb, which is FDA approved. So how do you see these results? How do you find the results as far as PRP is concerned for hair and handheld laser comb home use?
You see, there is a lot. Presently, there is no standard protocol for PRP. People have used 10 mLs, 20 mLs. I know certain doctors who are using 250 mLs. They withdraw the blood 250 mLs, and then they get pure PRP, which is platelet-rich plasma. It comes to a significant, and they use it once a year, and they've got lovely results. Then I've seen patients. So But then not all patients would benefit from it. So you have to really understand it's an adjuvant treatment, and if you commit your patient for PRP, it's like a lifelong. It's not like only 3 treatments, 6 treatments, 8 treatments. Once they achieve a certain level, after that you have to really make sure that they come back for maintenance. Now, how I treat it, I put every patient on PRP, and if the patient do not feel an improvement by 3rd treatment or 2nd treatment, I do not go to the 3rd treatment. The patient should feel after 2nd treatment, by 3rd treatment, patient should feel that thing. By 4th treatment, patient should see the improvement. By seeing means the improvement is 25%. By feeling means the improvement is 15%. So if you cannot feel by the 3rd treatment, I stop the treatment, because that treatment is not for that patient and I don't want to waste the patient's money. When it comes to the low dose laser treatment, it's an adjuvant treatment. Low dose laser treatment with PRP, it really helps if you use that thing. So what I do is that I give them a handheld laser from Lexington company, so they buy it, they use it every day, although the company says that it should be used thrice a week, but I ask them to use every day, right? There is no harm in it. So you use every day, it takes you about 20 minutes, and the patients, those who use every day, are quite happy with it. So my regime is everybody goes on the PRP first, and this thing, if they can maintain it and happy, good. Otherwise, I'll put them on spironolactone. If they can maintain that thing, wonderful. If nothing is working, then I go to the oral minoxidil and spironolactone combination treatment. There are a few other treatments coming up in the market, and I think they have got quite positive results. One is that you take the biopsy, you take the bulge area, you crush it, you make a solution out of it, and then you re-inject it, and that one treatment will give you a result for 2 years. And at the same time, but it's quite expensive, because the kit is for $500 to $600. So it's an expensive treatment, but it's a non-surgical treatment.
Any questions from the audience?
You see, yes, you're talking about finasteride 5 milligrams? Okay, fine. Finasteride, there are different studies. 1 milligram studies, they did not have enough of what you call as the number. The studies was very weak. But this last study that I mentioned, it was 87 numbers, and they were done for 1 year evaluation. And of that, only 1 patient dropped off because of the complication, which is headache. The rest of them went through it, and the studies were 81.4%. And it was for both pre and post-menopausal, and the results were more or less similar, right? And so there was no problems with that. However, having said that thing, if she wants to have a child, you want to stop that thing, because it can be teratogenic, right? Coming to minoxidil, yes, one of the problems is the hair growth on the face. So you need to understand, initially the people who were asking to use twice a day, the half-life when you are applying it is about 12 hours or even 18 hours. So I ask my patients to apply once a day, that's it, at night. They will still have that hair. Now, you have to choose between having less hair over here or some hair on the face, and that some hair is not like terminal hair, it's like a vellus hair. And Q-switch is a wonderful treatment, or not treatment, I would say a management of those vellus hair. So if you use that Q-switch, it will really give you a nice clean face, and you can use that thing. But unfortunately, you are between the devil and the deep sea, so you have to decide which way you want to go. Sir.
So finally, remarks from Dr. Atif Kazmi on this.
It was a very illuminating talk by Humayun as usual. I have certain comments.
Sir.
First of all, the most important thing in a patient of hair loss is the age of the patient. That is most important to identify the cause, as rightly said by you. And all these treatments which you have mentioned, they are being practiced in our field since a very long time, right? Including PRP now. I personally feel that we should only go to procedural treatment this is my personal experience of the last 40 years in dermatology, when we find that this patient is absolutely resistant to conventional and orthodox type of treatment that we have been giving for a long time. You have not mentioned the name of topical preparations such as Canthridine, such as Capsicum, DNCB, which do help a lot in those hair follicles which are in the resting phase. And after the application of these topical lotions or gels, there may not be need of PRP, there may not be need of other interventional procedures in certain patients. Across the board, obviously it is not possible, you have to find the cause. So that is number one. Number two, when you are giving finasteride, you have to be very careful, again in the females, when we are giving the finasteride. We all know the side effects, we all know what finasteride can do in the longer term, not for a shorter term of period. Then ultimately the diffuse hair loss that we generally see in females, it is correctable initially if the patients come to you. And what I have seen is in DHL, in chronic patients above in the 4th or 5th decade of life, if you give short courses of steroids, that would help a lot. That wouldn't give complications and no side effects to the patients. So what you can do is, you have to give a cocktail of therapies in these patients. You cannot manage these patients with only 1 or 2 medications. And then ultimately, we should all remember, we are all now in that era where lasers and interventional therapy is there, that every patient does not require PRP. Every patient does not require a laser. This is very important, I'm talking about my experience in King Edward Medical College, then now, that you have to pick and choose your patients for the surgery, for PRP, and spironolactone again has its plus and minuses. So personally I feel with what I do is that I do all these procedures, but then not initially. You just select the patient, select the best medication for the patient, go with that, and then you have so many options. One by one, you can try the other options, rather than jumping up to a therapy which is more aggressive in a patient, and then remembering the age of the patient. Younger patients, younger females,